Hello, dear friends. I am Dr. Banshi Saboo, currently Secretary for Diabetes India. I am Chair for International Diabetic Federation Southeast Asia and Vice President of Diabetes Asia Study Group. Today, I talk the anti-diabetic medication and their cardiovascular benefit or CV effect of anti-diabetic medication. We treat diabetes not for just purpose of glucose control. Our purpose is to prevent complication in person with diabetes. So these anti-diabetic medication should have a beneficial effect for cardiac as well as for other complications. This story started after a molecule rosiglitazone came in picture and shown that there is an increase in myocardial infarction. It means each and every anti-diabetic agent which is coming in the market should have a beneficial or at least neutral effect for cardiac problem in a persons with diabetes, and that had become mandatory in US FDA in 2008. Later on, EMPA-REG outcome trial had shown first time this beneficial effect of empagliflozin, and it had changed the paradigm, the way we are treating diabetic patients. Before that, the gliptins were there, but it had shown non-inferiority, and rather there was increase in hospitalization for heart failure. All other older drugs, they could not do their dedicated cardiovascular outcome trial, but GLP-1 had shown the benefit as well as anti-atherosclerotic effect of their GLP-1 molecules. And that's the reason today the first choice of therapy in a diabetic patient, either with a comorbid condition or established cardiovascular disease, it is SGLT2 and GLP-1 analog. While the patients who are on older drugs, we had tried to find out their benefit, or in a patients with cardiovascular disease, whether they will give any benefit or not. This was for a metformin. We had seen in UKPDS, it had shown actually a cardioprotective benefit. Similarly, the sulfonylurea indirectly in a Carolina trial, it had shown almost similar effect like linagliptin. So all other older drugs were also tried. The alpha glucosidase inhibitor in a pre-diabetic population in a Chinese dedicated trial from China had shown a neutral effect in a patient with cardiovascular disease, and similarly the insulin had also shown no increase in cardiac problem. But primarily now, to decrease the cardiac problem in a diabetic patient, it was GLP-1 and SGLT2 had established their role. So first choice for our diabetic patients become always either GLP-1 and SGLT2, both decrease weight also, and also decrease the cardiovascular disease problem also in progression with the diabetic patient. Thank you. Thank you.